So as a paramedic or first responder, everyone's talking about it. Elijah McClain, Aurora Paramedics, ketamine overdose in 2019. Let's talk a little bit about it. Now, for those of you who don't know the story, let me catch you up a little bit on what happened. Elijah McClain was a 23-year-old in 2019 who was walking down the street when a store owner saw him wearing a ski mask and apparently called 911. Now, the cops got there and they tried to subdue him with a chokehold of some sort, and it sounded like he was, again, I don't know, I wasn't there, but it sounded like he was resisting. Now, I'm sure there's tape, there has to be some sort of proof of exactly what happened. I don't know it, I didn't see it, I wasn't there. I'm not here to talk crap about what somebody else did on scene. That is not the deal of why I'm making this video. We're just talking about how it was treated and what happened. Paramedics came on scene. It sounded like they had a two-person crew, and immediately the paramedics went down their excited delirium protocol. Now, they were just saying that the scene was chaotic and this young male seemed to be resisting arrest, so they decided to give the patient ketamine. So behind me here is their protocol for excited delirium. They expected that the patient was excited delirium. So it says if the patient is in excited delirium, these patients are truly out of control and have life-threatening medical emergency. The first thing on there is to give them ketamine, which honestly, I don't have anything against. It's kind of difficult to say, hey man, this person has excited delirium, right? Do they have a medical history? Do we know their medications? Could we say that this patient has a psych history? Could we give antipsychotics or benzodiazepines, whatever the case might be? They chose to give ketamine. I'm cool with it. So here's Aurora's page or protocol on the actual drug of ketamine. A lot of good information that everybody else knows as paramedics. Little interesting, they have the drug dosage here as 5 milligrams per kilogram IM if the patient, because obviously, I mean, we're talking about a patient that is combative, right? I'm not going to, let's lay this guy down and I'm going to try to get an IV. No, that's not the case. If we're giving ketamine for excited delirium or trying to control a patient who's combative, we're going to give it IM every time, okay? I'm not checking vital signs. I'm not going to say, hold on real quick. Let me go ahead and check a pulse and get a blood pressure. No, we are going to give them an IM dose of ketamine, and then we can go ahead and continue our assessment. Now, before I continue, let's take a look at what the new national standard is for the latest textbook that's out. Here we got ketamine, the adult dose, and the one that I want you to take a look at is right here. It's chemical restraint. Give the patient 2 milligrams IV, that's 2 milligrams per kilogram IV, or 4 milligrams per kilogram IM for chemical restraint. So it's a little bit lower than what their dose was, but remember, that's their medical control. Their medical director makes those decisions. So now your next question has to be, well, he doesn't look that big. How much ketamine did they really give him, right? And how much ketamine should they have given him? So just by looking at the photo, what would you think as a paramedic? Let's say he wasn't giving you any answers, right? He wasn't talking to you or anything, and you had to decide a dose for him. Believe it or not, he weighed 143 pounds, okay? He weighed 65 kilograms. So if we use the National Registry and we use the standard, he should have gotten 260 milligrams of ketamine, IM. If we used his protocols, he should have gotten around 325 milligrams of ketamine IM. But they gave 500 milligrams of ketamine. Listen, hindsight's always 20/20, right? I'm not going to stand here and say what they did was wrong and they should have known better because I wasn't there. I don't know what the guy was wearing. Did he look like he was bigger? Did they think that he weighed a lot more? I don't necessarily know. But what I do know is there have been convicted, guilty, and this is something that we as paramedics need to consider every single time we give medications. Are we given the proper amount? Is if we're guessing weights, be better. Sometimes it's not easy, and to jump to conclusions to say that somebody's in excited delirium, just make sure that you're making good judgment calls. Unfortunately, the legal system can only take care of first responders so far. And right now in history is probably like the worst time to make a mistake. So pretty terrible news. Again, I'm not going to sit here and tell you that they should be guilty or they should be innocent. I'm just here to give you what are some of the facts that I've seen. And, really sorry for not just the paramedics, but also for Elijah McClain, man, and his family. He seemed like a good guy. He seemed like he didn't deserve what he got, and it's a terrible case. It's terrible in all the sense. I mean, you can't imagine that paramedics would have done this out of like they wanted to hurt him or anything. Absolutely not. So it really sucks to see. But if you know any other additional information, add it in the comments. And happy holidays, everybody.